Good morning, everyone. With respect to our COVID-19 activity, we continue to be at high but stable levels. Our weekly case count, which we know is less than we would have expected because so many people are doing home tests. So our weekly case count of confirmed tests, laboratory confirmed tests, is about the same as 2 weeks ago. So about 700 new cases in the last week. Our hospitalizations are up very slightly, as are our new admissions, but really no significant change. So the bottom line with COVID-19 is that we continue to experience high but steady levels of COVID-19 activity when we're looking at our new case counts, our hospitalizations, our sewage surveillance. Really all of our metrics show high but stable COVID-19 vaccines, COVID-19 activity, excuse me. So with that, I think it's really important for everybody to continue to look at their own risk tolerance and to continue to do what they think is in their best interest. Certainly, if we look at our communities, community level is high transmission for most of our communities in the Roanoke City, Alleghany health districts. So that's really concludes our COVID-19 activity, high but stable COVID-19 activity for all of our metrics. With respect to hepatitis A, unfortunately, we continue to just have hepatitis A percolating in our community. We continue to get new cases reported to us. Our total case count for 2022 from January through to today is 79 cases of hepatitis A, 58 hospitalizations. So slow but steady hepatitis A, and thankfully we're not seeing the high number of weekly cases that we were seeing earlier in the spring. With respect to monkeypox, at this point, Virginia Department of Health continues to report monkeypox cases at the regional level. And I can tell you that the Roanoke City Alleghany Health District is working with community partners and with healthcare providers to identify individuals who are at greatest risk of getting monkeypox, and we have started offering vaccines in our community for those individuals who are at highest risk of having monkeypox. So certainly we would encourage people who think that they're at high risk, and these are individuals, men who have sex with men, anybody who has multiple sex partners, individuals who may be commercial sex workers, anybody who's at increased risk of being exposed to monkeypox can certainly contact one of our health departments, and we can add them to the list of individuals who are interested in getting monkeypox vaccine. And with that, I will open it up to any questions. So the Virginia Department of Health is not releasing because these are still small numbers. Virginia Department of Health is not releasing cases by district at this time. It's releasing cases by region. So we need to look at the Southwest region. We have administered over 30 doses here in the Roanoke City Alleghany Health Districts.
Good morning. How does the vaccine for monkeypox work? Is it similar to that of COVID? Are people still having symptoms right after their first shot as they did with the COVID vaccine?
Well, so it's a very different type of vaccine. It's really related. So monkeypox is an orthopox virus that is related to smallpox virus. And so it's actually a very similar vaccine to smallpox vaccine for all practical purposes. What we're seeing, across the country, every vaccine has similar side effects with respect to sore arm, maybe a little bit of body aches, but we're not seeing anything concerning at all. This is a safe, effective vaccine for the very sort of limited group of individuals for whom it is recommended at this time. So there are a couple of questions. So I hope that answers your question. A couple of questions about what do we expect to see with current COVID-19 activities holding steady? When should we see our activity decrease? We don't know. This virus continues to surprise us every step of the way. What we do know is that B5 continues to be the predominant circulating strain, and that strain is more contagious and does appear to be able to evade immunity, both from vaccine and from natural immunity, more effectively than some of the earlier strains. So that's one of the reasons why we're seeing higher cases again this far into the pandemic. So we don't know what the future holds. The reality that it's been as stable as it has been over the last couple of weeks is fairly reassuring. And certainly I am very hopeful that we'll start to see decreases in the next couple of weeks. But I with this virus, we really can't predict the future very well. As students are heading back to school, do you have any guidance for parents related to COVID-19? And I think that, I think that this is something that we really believe at this point in the pandemic, where we have so much baseline immunity, even though I just said that B5 evades immunity, there's still protection from vaccine, there's still protection from natural immunity, and we have more therapeutics available to us, and the virus is less virulent today than it was 2.5 years ago. And so for all of these reasons, we're really adopting the approach that individuals need to do their own risk tolerance assessment. And certainly we fully support that anybody who is not up to date on their vaccines become up to date on the vaccines. And we would highly encourage parents who are concerned about the impact that COVID-19 may have on their child's school experience to get their child vaccinated. That is a parental decision, but we certainly encourage it. And one of the things I'll do in our local data is provide you with the most recent statistics from Centers for Disease Control about the hospitalization rates by age group in vaccinated versus unvaccinated individuals. And what we know this far into the pandemic, while the vaccine is not as effective as we would like it to be, it is effective at decreasing morbidity and mortality, so severe illness and death associated with COVID-19. And those statistics really bear out even this far into the pandemic. So I'll add that to our local data so you can have that visualization. Bottom line, we strongly encourage people to continue to get vaccinated, to be up to date on their vaccines, and to do what they can to mitigate the risk based on their own risk tolerance. Can you get monkeypox from simply brushing against someone? So monkeypox, if you think about monkeypox, it's direct contact with someone who has the disease. So the monkeypox virus can live in the scabs of someone who has monkeypox for quite some time. And that's why it's really important for individuals who do have monkeypox to stay isolated and not have direct contact with other people until their lesions are completely healed. But so the virus lives within the vesicles, within the lesions of the monkeypox sore. And so it's not going to be brushing against someone, but if you have direct contact, skin to skin contact with someone who has the lesion, there is a chance that you could get it. I can't emphasize enough that this is direct contact. There is a very, very low risk of respiratory transmission, but overwhelmingly the transmission is direct contact with the skin of someone who has monkeypox sores. To be a little bit graphic about it. So just directly brushing against someone is extremely low risk. We've gotten asked a question about what about trying on clothing. There is a theoretical risk, but it would be extremely, extremely low. So people just need to take, this is not something to be panicking about at all. And certainly anyone who's diagnosed with monkeypox needs to be very, very careful about protecting the other people around them, covering their lesions, and really being in isolation until their lesions are fully healed. So there's a question about all of the questions. There are a lot of questions today. That's great. What should people look for? What symptoms should people look for with regard to monkeypox? What should they do if they suspect that they have it? So with respect to monkeypox, this orthopox virus is a virus. So people are likely to get viral-like symptoms. So fever, myalgias, but the classic thing is what I just called a vesicle. So it's a skin lesion that looks like it's got some fluid in it. That would be the classic thing. the classic rash. And typically what we're seeing is individuals having them in their either on their face or on their penis or on their vagina, depending on where the contact is. It can occur on any part of the body, but those are the two most likely places that we're seeing it. So I think I answered that question. Sorry, I'm just going through this. General guidelines about schools following this year when it comes to COVID. We've really changed our guidelines as, again, all of the situation about COVID-19 has continued to emerge. So right now, the recommendations are any child who has COVID-19 needs to isolate. So that's someone who has COVID-19 or someone who has symptoms consistent with COVID-19 needs to stay home until they test. If they're positive, they need to isolate for the full 5 days. And 10 days if they can't wear a mask. We're not recommending quarantine. The Virginia Department of Health is not recommending quarantine in the K through 12 setting anymore. And bottom line is outbreaks are still reportable. So while we're not focusing on contact investigations, case investigations and contact tracing anymore, as it's become fairly widespread and as the disease has evolved to be less dangerous and higher vaccination rates, higher immunity rates, our guidance has changed. So the guidance this year is a little bit different from last year, but we're asking schools to still do everything that they can to decrease the risk of transmission in their communities. So those are the guidelines. I hope I answered both of those questions. Do we anticipate schools to have monkeypox outbreaks? No, not at this point. I mean, I think all of us are concerned across the globe, across the country, and across the state about looking at some of the behaviors that put people at increased risk of getting monkeypox, and that's having direct physical contact with someone who has monkeypox. And so, we certainly encourage people to we know that people are at greater risk if they have multiple sexual partners, and if they have anonymous sexual partners, and if they're a commercial sex worker. Those are all things that are risky behaviors. This is not something at this time, and we certainly don't expect it to change anytime soon, hopefully ever, that this is going to be a general risk that would cause an outbreak in a college. But certainly if someone is engaging in high risk sexual behavior, even though this is not considered a sexually transmitted disease, this is considered a direct contact disease, they are at increased risk of getting monkeypox. So people should use common sense. So this is a question that we're getting a lot. Should I get the COVID vaccine now or wait until later in the fall when we'll have a new vaccine? There are no recommendations at this point to postpone. If you are if you are in a group that a booster is recommended, don't wait, get it now. If you're interested in getting vaccinated, and certainly I would encourage that. We are not recommending that people wait until the new booster comes out that will have additional coverage, because we don't know the timeline for that. So nobody is recommending at this time for people to wait. They should be up to date according to their where they are. Right. So at this point, monkeypox vaccine is only recommended. Thank you. That when we're trying to make sure that this is clear, that monkeypox vaccine is only recommended for contacts of cases or individuals who are at high risk of transmission. So hopefully I've answered the question about, no, not everybody should get this. This is only indicated for those individuals who are at high risk of being exposed to monkeypox. And those are individuals who have multiple sexual partners, individuals, men who engage in sex with men, commercial sex workers, and really anybody who's having anonymous sex. Anybody who's engaged in high risk sexual behavior should contact us, and we'll screen them for whether they're eligible for vaccine. I cannot stress enough, monkeypox is not readily transmissible, and this vaccine is not available to the general public. It is only available to those who are at high risk of getting exposed to monkeypox. How much stock do we have? There's a very limited amount of monkeypox vaccine that's available, so we're using it only for those highest risk individuals, and the number of vaccines is dependent on the needs of the locality. I think I've answered the questions about the number of cases. There's a website that you can go into that's available. Chrissy, if you could put that in the chat, that would be great. That has the cases in Virginia by region, and that's updated as whenever there are new cases. Could monkeypox be the next pandemic? It's obviously already an agent of concern declared by the World Health Organization. It's happening across the country, across the world. So it is a pandemic, but we don't expect this to be anything near COVID or a pandemic flu, for example, because of the difference in transmission. President Biden was the medicine that President Biden was given, Paxlovid, after he tested positive, caused another positive. So I think we need to be careful. The question is, caused another positive test result. Should people get that medicine, and when should they retest? So what we know about Paxlovid is this is an antiviral for people who were at high risk of developing severe disease associated with COVID-19. So it's not recommended for someone who is not at high risk. So for example, if someone's above the age of 65 and they get COVID-19, that would be a reason to talk to your doctor to see if you should get Paxlovid. If you have underlying lung disease, asthma, if you're on immunosuppressants, there are a lot of reasons why it might be in your best interest to take Paxlovid if you develop COVID-19, because what we know about Paxlovid is that it dramatically decreases the risk of hospitalization and death associated with COVID if you're in a high risk group. Now there are cases, we've all heard about them, and certainly President Biden had this, where it's called rebound, where someone tests positive and becomes ill again, actually feels sick again after their Paxlovid, after their 5-day course of Paxlovid. And we're still learning about that. We don't have all the answers to that. But the recommendations are pretty clear that only people who are at increased risk for severe disease associated with COVID should be considered for COVID-19, and individuals who are curious about it, who are interested in knowing if that's the right thing for them, should talk to their physician or their pharmacist about that, to their healthcare professional. And I think we're at the end of the questions. I apologize. I'm looking to make sure I covered them all. If I didn't cover it, because there are a lot today, which is fabulous, if I didn't cover it, please feel free to speak up. And I was kind of doing those rapid fire, so if you'd like me to repeat anything, just let me know.
Can you hear me?
Oh, now I can.
Okay. I had a question in the chat just about monkeypox. I was asking if the vaccine supply was only limited because there isn't enough for everyone, and is the low supply a concern right now with there being more cases kind of popping up?
So, I mean, that's a bit of a challenging, we do not have enough vaccine for everybody, but that's not why we're not recommending it for everybody. We're not recommending it for everybody because people who are not in those high risk groups don't need it. This is not a disease that is casually transmitted. And so there is zero reason why someone who's not in one of those risk groups should consider getting vaccinated at this point. There's no reason. Do we have enough vaccine if everybody wanted it? Absolutely not. We're not in that situation. But it's almost a moot point, because you shouldn't get vaccinated for something if there's no indication for you to get vaccinated against that. So I think it's really important for us to use the existing supply of vaccine for those individuals who are most likely to benefit from it. And those individuals who are most likely to benefit from it are individuals who engage in high-risk sexual behavior. So I hope that answered your question.
It did help. But I also wanted to know if you think that you might be seeing some symptoms, or that you might have it, because I know there are a few things that, I mean, it could be linked to anything. Should you then just call a healthcare provider to be tested?
Yes, and I want to be careful. I'm going to push back a little bit about this could be linked to anything. This is not a readily transmissible disease unless you're having direct skin-to-skin contact. There are theoretical risks that have not, at this point, played out. It is direct skin-to-skin contact. So someone isn't going to get it by, in the beginning of the first 2 years of COVID, we recommended masks in public spaces because it's a respiratory transmitted disease. You can get it anywhere because it's in the air that we breathe. That is not the case with monkeypox. Monkeypox requires direct skin to skin contact for the most part. And I know I keep saying for the most part, but we need to go where the evidence takes us. So this is not something that you're going to get just casually. It really requires direct skin to skin contact overwhelmingly. And so I think it's really important for all of us to keep in mind that unless something drastic changes, and nobody is expecting that, this is something that we can contain by doing the limited vaccinations that we're doing to decrease the risk in those high risk individuals, and making sure that people are changing their behavior to adapt to the current situations. So I certainly, we don't say this to try to increase, to look to judge behaviors or to, we know that sexual behaviors can be stigmatized, but at the end of the day, it's also important for people to realize that we do have a monkeypox epidemic, and this is not the time for individuals who engage in high-risk sexual behaviors to engage in high-risk sexual behaviors. It's really the time to adjust our behaviors to try to get ahead of, or not ahead of, but to respond to this pandemic. So I hope that, yeah, absolutely. I hope that helped. Can you describe the strain, if any, of monkeypox that's putting, sorry, I was thinking strain as in viral strains, but the strain that it's putting on the healthcare providers and professionals in the Roanoke area. At this point, it is extremely limited in the Roanoke Valley, in the Roanoke City and Alleghany health districts. We are in direct contact with our healthcare providers, our healthcare professionals, our hospitals, to make sure that they know how to contact us if they have any concerns. We certainly have the capacity to address the number of cases or potential cases that if someone needs to get tested, we certainly have the capacity to address that. At this point, I'm not seeing any strain at all on the healthcare providers in our area. Any updates on research into the pediatric hepatitis cases of unknown cause? This is still something that's an ongoing investigation across the country and across the globe. I don't have any updated information other than in Virginia, there are individuals, what we call PUI, persons under investigation, and that's been an ongoing situation. But at this point, I don't have any updated information on the status. CDC and Virginia Department of Health certainly have information as we move forward, but this is still a situation where we do have cases in Virginia of persons under investigation. We do not have any currently in the Roanoke City, Alleghany health districts, and this does appear to be relatively limited. But of course, for the parents of children who have hepatitis of unknown etiology, it is a concerning situation. This is not, we are not seeing high numbers of cases. We don't have any persons under investigation in our community. All right, any other questions from not from chat? Anybody want to ask any questions? And I'm happy to repeat anything. I know I was going pretty quickly to try to answer this flood of questions on chat. So if there's anything that you need me to answer again, no worries, I'm happy to do so. Okay. Well, thanks as always for your interest, and let me know. Oh, there's one there's one more question, and definitely let me know, or Christy know, if you have any questions. With polio in New York, are there any precautions, preparations happening here? So I want to be careful that we know of one confirmed case of polio that is associated with the oral polio vaccine in New York. There is concern that because paralysis associated with the oral polio vaccine is very rare. There's concern that there might be other cases, but that is an investigation that is ongoing. This is an important reminder, so thank you for bringing this up. So we have not given oral polio in the United States since 2000. Oral polio is still given in some other parts of the world, but it's not given in the United States. But it is a reminder for all of us that we live in a very small world, and what's happening in any part of the world can affect any one of us at any time. And that's why it's so important for us to remain up to date on all of our vaccines. And so for me, this is a reminder that we just need we need to never let our guard down about vaccine preventable diseases. Polio is 100% preventable. We were close to eradication at different times. We're still hopeful, the global we, that we can eradicate polio. But we can only do that if people are up to date on their vaccines. And so it is really sort of disconcerting that we had a case of polio in the United States. It represents a failure of our systems when there are individuals who are unvaccinated against these vaccine preventable diseases. But it doesn't represent a huge threat in any sense. We are not doing any specific preparations other than this is a transition to back to school. We need to make sure that all of our children are up to date on their recommended vaccines. It's critical. This is a reminder that unvaccinated communities can face new diseases in their communities. We haven't seen polio in the United States in a long time, and this is a stark reminder of the importance of making sure that all of our children are up to date on all of their vaccines. And back to school time is a perfect time to do that.